Good afternoon, everybody. Welcome at the Urban Center of Trieste. I'd like first to thank all the guests of today's event. So, Filip Stipancic, founding partner of Lean Startup Croatia, Vlatka Petrovic, head of the Technology Transfer Office of University of Zagreb, and to startups, Numi Health and Emens, that will introduce later their business. So supporting innovation in the life science sector requires typically the coordinated actions of different players, both at the national and at the international levels. So this event goes in the direction of creating an ecosystem, an international ecosystem, focused on supporting innovation in the life science sector. I would also like to introduce Barbara Koden, who is the General Manager of the Urban Center in Trieste, and myself, Marco Del Ferro, who I am in charge of the startups here at the Urban Center. So, Barbara, I'll leave the floor to you, presenting the Urban Center of Trieste.
Thank you, Marco, and thank you for our valuable guests here to welcome you in Urban Center. And I would like to introduce this project because I think it's something peculiar about our territory. And I really like to open the idea of open or to delete the border between our country, our land, our ecosystem. So Urban Center is one of the places where public and private organizations work together in order to promote innovation. Urban Center is based in Trieste, and Trieste is a representative site for science that can become innovation. Trieste is the capital city of Friuli Venezia Giulia region, and as you can see, right, this is quite old because in these days there is a new regional innovation scoreboard from European Union that still enhance Friuli Venezia Giulia as a strong innovator in the field of, in particular, science, but also through the path between science and business. So coming from an idea to a product that goes to the market. So Trieste is also the home of 30 research centers. Some of them are really old. When Austria was here during Maria Teresa government, and because of this high number of research centers, we have also one of the highest concentration of researchers, at least in Italy, is almost 40 researchers every 100 workers here in the city. From the science, we have also businesses. So we have the instrument that usually is one of how innovation evolves. So we have a lot of innovative startups. Is one of the highest density. We are almost the same density as Milan. That is one of the innovation capital, not only in Italy, but also at the European level. And in 2020, that was maybe not the most the luckiest year to become the European City of Science, and we host also the ESOF event. So because of these historical reasons, we have all the partners, the actors, the stakeholders that that we need to create an innovative ecosystem. So a place where an idea can become a project and then a product and goes to the market. So we have, as I told you before, a lot of research center, but then we have all the stakeholders, both from a technical point of view, so like incubator as Bio for Dreams or accelerator as BioValley Group, but also from the financial point of view. So we have both bank and something that comes from the history of the city, insurance. So there is a good place where these stakeholders also speak together in order to give the possibility of an idea. Usually comes from the scientific centers like university of research center, but also from people that in this area can like also get in touch directly with science. So Urban Center is a public project because the municipality of Trieste has started its project a few years ago, renewing a building that was one of the oldest building of Porto Vecchio, the old port of Trieste, and it's now the house of the startups. And they placed this building, this area, with two peculiar teams. So bio, high-tech, and high-tech sector. So they would like to have direct in the city center an international reference hub for these sectors. So in this idea, we can put together all the stakeholders. We saw that they are present on Trieste area, and try to let them speak together in order to promote innovation. So the municipality of Trieste promoted a tender where Bio for Dream, as a leading partner of the consortium, won the tender, and we have managed the urban center since 2021. So the project is quite new, but we really have had a lot of interesting results. And the first of them are the partners network that since the beginning has believed in this project. We have now more than 50 partners that both works together and develop the ecosystem in order to promote, to support, and to also to guide the startups that grow here in urban center. So the building is a structure in 3 floors, like the activity that are delivering in the same area. So at the ground floor, we have the Fab Lab. It's demonstrative Fab Lab where people can get in touch to the new technology like 3D printing, scanner, and laser cutter to test and to see if like their idea can become something real, a prototype. In the first floor where we are now, it's the functional contamination floor where we meet together, and this is one of the main way, the most important way we can promote in order to keep in touch without borders, without distance. So also the technology here present are available to enhance and promote the networking. And on the second floor, we host now 21 startups that are in the field, that work in the field of the urban center sector, so bio high-tech and digital high-tech. Since the beginning, we have hosted more than 200 events here at the functional contamination floor, and 150 events in the Fab Lab, in order to promote also the for people to come to the center, to try, to test, and to speak together, because from like learning a new technology, 3D printing, now it's something that is quite usual, but you can share your idea, and also to create a team that can work on that idea. So we reach almost 14,000 people, both in present, but most online, because after the pandemic period, one of the main way to follow, to participate to an event is also to look at him after. So we have a library of events that are on the website of the Urban Center, and this is something that we create, an innovation library. So people can look through them and also to have information in order to promote also their idea, like grant office. And here in Friuli Venezia Giulia, thanks to the activity of the region, we have a lot of grant opportunity that are very important for both companies, but also even more for startup at the beginning of their journey. So I've introduced what is the instrument to reach the final goal. So it's innovation, and also to promote entrepreneurship in the field of biotech and digital high tech. And then I let Marco to introduce the startups of the center.
Thank you, Barbara. So today there's 21 startups settled at the Urban Center of Trieste. We decided to put this image representing all the startups moving around the Urban Center of Trieste, because in addition to the physical place where startup can develop their business, the idea is that the startups may contact each other, and they can take advantage of the network and all the knowledge taken and provided by the managing partners of the Urban Center. So 21 startups settled now. Of them, interesting, 14 are coming from the Friuli Venezia Giulia region, Friuli Venezia Giulia regions. 5 startups are coming from other region than Friuli Venezia Giulia. And this is interesting because the startups from other region decided to put an operative site here in Trieste, because the Friuli Venezia Giulia region is, they provide a lot of funding opportunity to startups. So startups come to Friuli Venezia Giulia to apply to the funding opportunities. And 2 startups are coming from Slovenia. And they decided to use Trieste as a base to develop their business across Italy. All the 21 startups belong to the bio-high-tech and digital high-tech sectors. Most of them, 10 in particular, belong to the digital high-tech sector. 6 startups are digital startups, but they are developing products related to the healthcare sector. 1 startup belongs to the area of the innovative therapy, the biotechnology and drug development, and 2 startups belong to the nutraceutical and veterinary therapy, and 2 to the biomedical in vivo diagnostic, in vitro and in silico. Typically, if you think a startup, you think to an entrepreneurship, which is in the very beginning phases of its development. Some of the startups, 1/3 of the startups settled here in the urban center, are already on the market with their products or their services. 1/3 are in the validation phase of the technology, while 1/3 are in the prototypation phase. So they span different levels of development. And as I introduced before, the idea of the urban center is not only to provide a physical space where a startup can sit and develop their business, but is to support the growth of the startups. So the managing partner of the urban center provide for free startups with services. Of them, the Grant Office Observatory, the network for prototypation, regulatory and clinical trials, and the industrial network, as well as the fundraising network. And in addition to them, we try to support the startups with helping them in setting up a presentation to the investor and to support their communication. What emerged in the months of working with the startups is that all the startups not only interacted with us, so the managing partner of the urban center, but as you can see from the red lines, they started to talk to each other. So one startup can provide services to the other, and other startups together developed joint project. So this is a really short presentation of the startup, but if you're interested in having more details about their business, feel free to ask me later. So now I'll leave the floor to Philip for a presentation of Lean Startup Croatia.
Thank you, Marco. Thank you, Barbara, for sharing all this information. It was really a pleasure seeing all the teams, and we would really like to know more about it. But imagine if tonight you coming your home and trying to read your book, but the only source of light is this small candle, which would be the case if we would not have the alternating current electricity, but also that, for example, tomorrow you do come to your office and have this blank piece of paper without the solid ink fountain pen, which was also one of the inventions coming from the Croatian famous inventor Slavoj Pinkala. So well, my point is that Croatia and this Croatian people have a long history of producing brilliant minds, which did contribute to the fields of science, but also technology, engineering, design, from the mentioned Nikola Tesla, Faust Vrančić, Ivan Vučković, and many others who had really famous inventions that we all need and use today. So it's a very small country with almost 4 million people, but still we do have this enduring spirit of creativity and entrepreneurship, which is today very much alive through the startup ecosystem that we'll be briefly presenting today, just only a small part of it. So the point today is just to give you a short intro about Lean Startup Croatia, which is only one of the ecosystem players in our ecosystem. Also to present to the IT Health Hub Croatia and the University of Zagreb, because our focus today will be more on the life sciences and health tech, to get a bit of information about our program for pre-acceleration of health tech startups, and to present two teams that we would really like to support and get them the ability to maybe access the market, or also pitch for investment in Italy or somewhere in our region. So just to briefly start about Lean Startup Croatia, since we are the connecting dot between the two ecosystems at this moment. We are a privately held innovation agency, and we started our journey 10 years ago in 2013 as a local ecosystem developer, organizing different meetups, events, mostly based on the lean startup and customer development methodology. In this time, we had opportunity to gather this community, but also learn a lot about startups and produce different tools and methodologies to help them actually apply those for the early stage validation. So until today, we had gained a lot of knowledge and competencies, also running real entrepreneurial real businesses and practicing what we preach through our work. We have a nice colleagues and a network of good partners who are verified and experts in different fields that are relevant for startup development. But also we try to be flexible and have this tailor-made approach in different projects. So over these 10 years, we were present in different territories, countries and regions in the world, doing some of the programs, trainings, workshops, events, and gathered different know-how that we can apply today, helping startups, but also other ecosystem developers. So condensing everything in 3 different things that we do, those could be innovation events like hackathons, innovation challenges, but most of our work is focused on innovation programs, which means programs for pre-incubation, incubation, and startup acceleration, and then some topic-based education, mentoring for entrepreneurs, startups, and even students and young people who aspire to become innovators or entrepreneurs. Just go briefly through a few selected projects to keep this presentation really brief. Maybe one of the things that we could mention is this program focused on women entrepreneurs, empowering women in agri-food that we had last year with 10 female entrepreneurs participating. Also, a good example would be started IT Academy for startups in Split and Dalmatia that we are running 4th year in a row in a region which is more focused on tourism and hospitality. Together with the local county, we're trying to boost this IT and technology sector. Another example would be Team Up, a project that we are running to actually gather the community and help startups get first employees, co-founders, and mentors. The point of Team Up is actually to enable them to pitch in front of this audience and get those team members in different verticals. So one of the Team Up events will just happen in 2 days on the topic of healthcare. So yeah, that's something that we are also working on at this moment. An interesting project in the area of green tech. This is for the population of students, of high school students and technical vocational schools that had to teach them about the entrepreneurial journey and how to actually develop their innovation from idea to a useful product or something they could place on the market. So this is just an overview of different let's call that target sectors and people that we are working with. And the last that I will present is just an intro to the next topic. It's called Get Started in Health Innovation. It's a program for startups in healthcare, a pre-acceleration program that we are running a 2nd year in a row with our partners from the University of Zagreb and Vlatka, who are going to present this in just a few moments, their activities. But I'll tell something more about the whole program in a few moments. So I wanted to give you just a few basic informations about the Croatian ecosystem and what's going on at the moment. As we are pretty small but still young and emerging ecosystem, we don't have much data about it yet, unfortunately, but we could gather some data from other foreign sources. So for example, considering this global ecosystem index from Startup Blink, it places Croatia as the 44th ecosystem in the world. But considering the last 4 years, we seem to be stagnating a bit. Although if you are looking at the data which is relevant for investments in startups, it doesn't seem to be stagnating, because there was a huge jump in the amount of money that was invested, but also decline in the number of deals. Still, the average funding size is about €500,000, a bit more. In few facts that I could present this ecosystem, I would say that we have a lot of the entrepreneurial supporting organizations, more than 500 at this point. These are mostly governmental or community-based enterprises and organizations which have a different way of acting, not always in synergy. That's why there is so much of those. We do have this dominant agnostic approach in startup development, so there is not many programs or initiatives which are focused on specific sector. Hotspots might be Zagreb as the capital, then Rijeka, Split, Osijek, and Pula. We currently have 5+, I would say, VC funds, because this situation is not so clear. But here we've seen a big progress. And if remembering the graph from the previous few slides where we saw the number of deals and the amounts, this was actually a result, because 5 years ago, let's say, there was not so many VC funds. Now this number is growing, and I would actually say that the Croatia is more part of the region of Southeast Europe, where both Slovenia, Serbia, Croatia, Bosnia, they all kind of play for the same venture capital funds as one market. We have 2 unicorns, which is a pretty good thing considering the size of the country and the population. So Infobip and Rimac Automobili, but we also had some of the exits recently, which got very good momentum for the ecosystem, like Photomat that was acquired by Google, Nanobit who was sold, but also some of the agencies, digital agencies who were sold, like Five and so on in the last few years. But also there is a huge speculations around different startups who are that we call soonicorns, or teams that might soon become unicorns, and who are very successful internationally and very prominent in this ecosystem. Going back a bit for this vertical specialization, because I think this is the next big thing that's going to happen in this ecosystem. It started happening a bit. So, for example, there is one small town called Lipik who got the first AI center. Then there is another small town called Novska who developed the gaming center. I see some initiatives to develop a blue economy vertical in Pula, but also there is an effort to develop health or life science subsector in Zagreb and county around Zagreb called Zagorje. So besides this, probably AI would be one of the most hot topics at this moment, because there are several different organizations and let's say people doing things around AI and trying to boost this part because it's so popular. But still, we are kind of lacking more vertical specialization in Croatia. Considering the life science sector, I would say there are a few key actors. One is the IT Health Hub Zagreb, Hrvatska, in front of the University of Zagreb, that we also would like to invite to present today. Here is Vlatka, who is leading this initiative. There is also Biocenter, the local life science incubator, something very similar to Bio for Dreams, but still has some place to catch up. There is a newly formed European Digital Innovation Hub called AI for Health, which focuses on healthcare system, but based on AI technology. There is also one initiative in Split, a project called NetHub. There is a Medils in Split, but also some corporate sector players who are becoming more interested in especially this digital healthcare and this part of the industry. So I would finish here with this intro part, and I would actually like to invite Vlatka in front of the University of Zagreb as a coordinator of the IT Health Hub Croatia, who has a lot of things to say about their work and impact over the years. So, Vlatka, please.
Okay, thank you, Philip. Let me share the screen. I hope you see it in the slideshow mode. So hello, everybody. Really glad to be here, to be able to present what we are doing at the university, and of course with Lean Startup Croatia on Croatian level, and also to meet colleagues from Trieste and see how we can collaborate in the future. So I will give a short presentation about the University of Zagreb and its role in life science research and innovation, and of course about its role as the EIT Health Hub in Croatia and the efforts we have been doing to build up and support the health innovation ecosystem. You know, of course, that Zagreb is capital of Croatia. It is located in the northern part of the country. It really does matter that a majority of the population of Croatia is really concentrated about this area. This brings about talents both in research but also in startup and in innovation sector. So the University of Zagreb is actually one of the largest in South and Eastern Europe. It is, I would say, a traditional university because it has this tradition of over 350 years, but at the same time, it is an active research and innovation-based university that contributes to 50% of the research output of the country. The university is comprehensive, so it covers all of the fields from technical areas like bioscience, natural sciences, humanities and arts, and social sciences. And you can see some of the numbers here. So I would say a large number of programs on all levels, close to 70,000 students and about 7,000 researchers or academic staff are active at the university. The university, of course, is active in the international environment, and of course, this includes the mobility of students, of staff, connections with other universities across Europe, and of course, joint studies, joint masters and joint degrees, and of course, international university networks, so participating very actively in different European initiatives. This also includes the European University Alliance. So we are a member of one European University Alliance. This is European University of Fast Industrial Cities. So really something that brings about reform and in education and research, and also leading towards innovation together with colleagues from all over Europe. To go back or to go to the topic of research and innovation, because we are a competency, then all the fields are active. All the fields are participating in this project, and of course, research, innovation and commercialization project, and they are being supported with various teams at the university level. So my team is the one from the Center for Research Development and Knowledge Transfer, and we sit at the central level at the university, really covering research commercialization, development and innovation strategy, with the management of the university, and of course the EU projects and EU project management. But we couldn't do this by ourselves because we are working with research and knowledge transfer offices that exist at different faculties. So the Croatian University of Zagreb, as you can see, has over 30 different schools or faculties, and most of them have research offices, and then in addition to them, some of them have knowledge transfer offices. So we all work together collectively to support the research and innovation efforts. And to just give you some examples of the university has been active in European framework projects, really starting even before Horizon, going back to FP, different FPs. But to give some data about the Horizon, you can see that there have been a number of projects that the University of Zagreb faculties entered into, and this was really about 80% of Croatian universities. So it was the University of Zagreb contribution, and it really has a strong involvement of different, science and technology fields in this project and its participation. So the teams are varied, as you can see. So it does involve, data. It does involve computing. It involves definitely natural sciences, also civil engineering and environmental sciences, energy, chemical. But you can see that also, of course, food technology, biotechnology, medicine, and biomedicines are very hard, very high on this list. We are, of course, striving and looking to achieve the excellence in research, and something that we would like to increase is, the participation in ERC grants as the top European grants. We have some participation, and of course the other one, the other subtopic, which was present in Horizon 2020 and now also in Horizon Europe, is this spreading excellence, so widening different types of projects. Now there are several in preparation, and we are very open to collaboration in that area, of course, with different organizations from all over Europe. But to take it back to the innovation, we have been active in biotech industry innovation. So this is an example of a licensing deal. The deal was closed actually with the Slovenian company, or originally it was a Slovenian startup. Now it exited and it was bought by Sartorius. So it was bought by a German major biotech company. We closed the deal while they were still independent, and it was really drawing upon the expertise that we have at the Center for Research and Knowledge Transfer in Biotech, which is in different elements of virus production, virus vaccine production. So this is really a long-term, I would say, expertise going, way before COVID, and involving different types of, virus strains, and involving different lines of research. So this is something that we are strong in, and also looking for further collaboration with different actors. Another aspect, for example, that I would like to highlight is functional genomics. So in that field, this is a team from the University of Zagreb School of Medicine. It is really led by a Harvard-educated, professor who has many international collaborations and projects. But on top of that, the team has been successful in bringing solutions to the market, bringing solutions to the patients with the support of the Croatian National Insurance. So really, in keeping, I would say, track, or keeping, keeping an effort to stay active, to stay at the top of the research field, but at the same time to create viable, feasible solutions that can benefit patients in practice. We have a number of ventures that have been developed that are from the bioscience, life science, or health area. And these are both, I would say, spin-offs and startups. So some of these are, spin-offs in terms of that they would have a connection with the faculty IP, but some of them are professional startups as well that then drove up different other aspects, expertise, and know-how, and some of them, now that you can see, they're already mature, they're spinning out their own companies, and some of them are very young teams that are now on this slide. What they're really spanning, again, different areas from biomedicine, from biochemistry, also chemical technology and processing, agri-tech solutions, data in bio data, but also data in other business applications in the health industry, and such. They do get, I would say, what we see is the building of a strong business. But there is a lot of innovative solutions at the research level. Researchers are interested in creating, ventures, in creating startups, and some of them that we see here have already done so, and now are also becoming an examples for the community. So really, people who are coming into the field, younger researchers, have somebody to talk to and somebody to connect who can also guide them in this process. On top of that, what we have wanted to do as the university and is to get involved more strongly in not just in research innovation projects, but is also in creating the innovation ecosystem. And what you see here is really our participation in what is EIT backed knowledge innovation communities. So EIT has more communities than this, but these are the ones that different units from the University of Zagreb are involved with. So not just our team, but also different schools and faculties. And I will talk a little bit more about the EIT Health next. But I wanted to mention really all of them to see that there is this, I would say, intense intent and of course, capacity in terms of being able and supporting the local ecosystem in collaboration with different European partners and actors. So for the EIT Health specifically, this is a knowledge innovation community. So it is backed by European Institute of Technology Innovation. It is all the KICs, so all these knowledge innovation communities are set up as public-private partnerships, meaning that in addition, of course, to EIT backing, there is a backing of different partners. And for EIT Health, this of course includes not only universities or private or institutes, but also it includes private companies, pharma companies, but also medtech companies. So really a number of healthcare actors who have gotten together to create this community that then supports innovation and entrepreneurship. So EIT Health is very dedicated on the European level to support entrepreneurs in different aspects, accessing knowledge, market stakeholders, and of course finance. It really does on the European level support and has a track record of supporting a number of startups, and also is specifically in enabling startups then to raise additional from public or private sources. So this, nurturing startups and also, following them and helping them along the startup journey is something that EIT Health is very strong in. And so what is going on with us in our involvement with the EIT Health? So basically, we are in something that is called a RISC Hub. This is a regional innovation scheme, and it is a program that then targets emerging and modest innovators. And of course, this involves only a section of countries. So these are the Eastern European countries, Southern European countries. You can see that Italy is there, but it's the southern regions of Italy that are part, and that they have a RISC Hub. That is connecting then to the EIT Health community. But again, EIT Health community is wider. It is the whole Europe, and then this network of hubs, it's a subset of that. The idea is really to build up the local ecosystem and then connect them with the wider European ecosystem and the community. So the University of Zagreb has been a hub for several years now, since 2018. And I can show you briefly, what this role of hub entails. So a lot of work is done on bringing, I would say, stakeholders together, in a different ways to start talking, to start discussions, but also to have, not just discussions for discussion's sake, but to lead into new innovation projects, to lead into new initiatives, to see how we can, not just create innovation, but also bring the adopting of innovation in different settings. And of course, for that, it is the role of hospitals as a healthcare providers that is absolutely crucial, and of course, a role of industry and Ministry of Health, in addition to the Ministry of Science, and of course, the academic community and startups. So you can see here the examples of the topics and that we have. It's really set up as a sort of a business branch that is very, I would say, relaxed. And in a way, we want to ease different stakeholders to start discussing freely and to then, brainstorm in a way together to solve issues and to solve challenges and to create new solutions. The other aspect of our work is working with students. So this is an example of the work that we do. So basically, Innovation Days are EIT Health Initiative, and as an EIT Health Initiative, they are held all over Europe in different cities. And each city, picks a challenge or picks a set of challenges that they want to engage students with. The idea is to have students, get the first taste, I would say, of the innovation process, to learn about the basic principles, to learn about the importance of user orientation, of understanding user needs, the basics of this design thinking methodology, and also to learn and to pitch at the end of the day, to present their own ideas. And so here we can see, the examples from the last year. The winners from each locale then compete and, of course, meet each other and network together at the European-wide event as well. So this is really a great opportunity for students, and it is open to students of all fields. It is also open to outside professionals, but I would say that most of the participants are students. And what is one of the strengths of this concept of this competition is that we build multidisciplinary teams. So we have, recognized that health is a multidisciplinary topic, and from the start, they start working, across from different, schools, programs, and faculties, and they do learn how to, to work and how to create something together. One of the, of course, important programs, and this is now a flagship program. It is the Get Started in Health Innovation, which Philip is going to present in detail. So the idea for the EIT Health and was to, in addition to some of the programs that are based on EIT Health methodology, and they are similar in different cities all over Europe, they wanted to give us an opportunity to create a local capacity building program. And for that, we went and sat together with our partners to be able to create something that benefits the local startups. And this is what Philip is going to present in more detail. All together, we want to give a leg up, from the students, from the researchers, healthcare, stakeholders, and also to the different startups. And of course, again, to bring it back to the EIT Health, this is the beginning of the journey for many of them, because the EIT Health has programs not just for like early stage idea and need that you can see here, but it has programs and support for then attracting investors, for entering other markets, for really going for investors in I would say in later phases, larger tickets. So there is the whole, as you can see here on the slide, there's a whole startup journey continuum that is available on the European level, and also programs that are available in order to develop the product, to develop the technology that the startups are working on. So we want to give, through our local programs, to give them a leg up to be able to access all these other programs that exist, whether on the regional level or on the European level. And of course, the overreaching idea, the overreaching mission for us as the EIT Health Hub is to create all these solutions and innovation to create a healthier, and better quality life for all the citizens of Europe. And with that, I will close. I really thank you for this opportunity, and I'll hear my contact details if you want to reach out and discuss any collaboration. Thank you.
Thank you very much, Atka, for the presentation. We see a lot of, I would say, shared approaches toward fostering innovation in the life science sector. So again, thank you for being here. Thank you for sharing all this information. From our side, I can anticipate probably something that Barbara will tell you later, is that Bio for Dreams, that is the manager of the urban center, I would say, is physically based in Milan at the Mind, which is the Milano Innovation District, which is going to be probably the biggest Italian area where all the scientific innovators are meant to set up their activities. So hospital, research centers, incubators, private industries. So again, the creation of an ecosystem that all together, all the players together can support the innovation is what we try to do. We see that this is something that you are going to do as well. So that's why we see a lot of connection between our ecosystem. So I'll leave the floor to Yasmina now to present Immense, startups coming from Croatia. So, I see.
It's
Yeah,
back to
so
Philip.
I'll just give a few minutes around the
Yeah.
program to set the floor for Yasmina, if that's okay. So Yasmina and Petar are part of this year's cohort of the Get Started in Health Innovation Pre-Acceleration Program. And maybe just a few words about this one so that everybody is informed. So this program has been supported by the IT Health and organized by the University of Zagreb and Lean Startup Croatia to actually empower and support health technology startups in Croatia and help them succeed globally. So what we are trying to offer is this specialized support for the startups in healthcare industry, which is lacking, and there is no other way of them getting support in Croatia at the moment. Interdisciplinary approach with the support of the university and the faculties. Also gathering partners from the industry, healthcare providers and science, and through the IT Health Network give the opportunity to grow and access international community. Then we also find this event as one good opportunity to establish such connections and relationships. So the organizers are the University of Zagreb, before mentioned, and Vlatka represented it very nicely, and in Startup Croatia that I also presented before that. So as explained before, most of the programs in Croatia are agnostic, so they're not focused on any verticals, and this was our response to actually create something in the area of life science and health tech, because we think this is an area which needs support and that we have a good groundstones because of the healthcare system in Croatia, which is pretty developed. There are a lot of people who are actually very knowledgeable and successful, but we are still missing opportunities to commercialize innovation in real sense. So we were aiming to gather participants who are students and researchers interested in the area of healthcare innovation, but also healthcare workers and entrepreneurs in this field. This is a second cohort of the program, which has a timeline of 6 months, starting with the market validation support part, where we are focused on actually validating the problem and their potential markets, and then entering the second phase, where we are actually supporting them to access the market through specific and individual mentoring, but also developing the knowledge through the topics which are important to develop the talent to access the market. Everything will culminate on the public demo day, 1st of December this year. What is specific for the program is that it's happening in hybrid mode, which means that we are doing some things on site and some things online, using good practices of gamification, following the progress of the teams through coaching and mentoring session, but also providing needed support. I mean, this is what I'm seeing from our perspective, but we'll maybe hear from the teams how they feel about it. So in 2022, we had 14 teams entering the program, and then we had 7 teams finishing it. This just for mentioned teams from the last year. 60% of the participants were female, 64% of them with life science background, and 30% PhDs or PhD students. We also were pretty covered in the media, and the whole community knew about this program. So some of the results we might share is that we managed to gather those teams, provide them with the education, and implement different educational and mentoring sessions, public events, but also enable some of the teams to access the market, some of them to raise first investments from angel investors, and so on. So we continued our efforts in 2023 with new teams. 12 teams enter the program. Now we'll get the opportunity to hear two of them, Nuove Health and Enhance, from Petar and Jasmina. But also there are some other really good and renowned teams that we are also placing a lot of hope in. And we are just in the middle of, at the end of the first phase, and planning to enter the second phase after the summer break. In this year cohort, we have half of the participants are female. Also, most of them with a life science background, and a quarter of them with PhD or PhD students. This is an image of all of the participants in this year. Important part of the program are the partners and supporters from the academia, but also healthcare providers and industry. For this year, we have partners from AstraZeneca, Selvita, and supported with the British Embassy in Zagreb, who will also enable us to visit the UK ecosystem and enable all of the participants of the second phase to get this experience in the UK and this international exposure. Besides those three key partners, we also have supporters, which are the University Clinical Center. This is also a primary care institution, the biggest one in Croatia, a medical faculty, a biocenter as an incubator, and pharmaceutical faculty, and the European Digital Innovation Hub AI for Health. Among others, those are important stakeholders that we will engage to actually provide the teams with the needed support through the second phase of the program. So this is just briefly this introduction. Hope it was informative to set the stage for Jasmina and Petar. So Petar and Jasmina are two teams, not Petar and Jasmina, but Enhance, Jasmina's team, and Nuove Health, Petar's team, are both participating in this year program. We are very happy to have them because we think they have great potential. They are doing a lot of effort. They also have previous experience, so we thought it would be a very nice for them to actually present today here, because they both are aiming for international partners, but also seeking for investors. So if we can start with Jasmina's Enhance, that would be great.
Yes, hi. So as Philip said, we're currently participating in Get Started in Health Innovation. So now I will share my screen, where I will briefly tell you about the solution we are working on as a part of essentially Get Started in Health Innovation. So what we're developing is Enhance, which is a non-invasive device for treatment of brain disorders. Before I get into what Enhance really is and what it is doing, I would first like to tell you a story. So this is Mr. S. For the past few years, he's been suffering from fatigue, cognitive and muscle dysfunction, so he decided to go to the hospital. The results of his MRI revealed that he has multiple sclerosis. This means that he is now well aware that his life will very soon change. He will be using a walking aid, then a wheelchair, and then at one point will be completely unable to leave the bed. So you must be now wondering, what does his normal day look like? Well, on a good day, Mr. S would wake up, he would take his pills, and he would somewhat be able to resume his normal daily activities. But on a bad day, Mr. S would wake up and he would not be feeling so well. His brain would be foggy and his muscles wouldn't function. He would then go to the hospital to get a corticosteroid injection, come back home, would still have to take his pills, but his symptoms wouldn't go away. He would then realize it's just one of those days and he would decide to go back to bed. Sadly, Mr. S is one out of every 5 people in this world that are suffering from neurological disorders. The cost of care for these people, which is a huge number, has reached over 1 trillion euros per year in 2020. So what if things could be different? What if things could change? What if Mr. S could wake up, put on a hat, and resume his normal daily activities? Wouldn't that be great? Well, introducing Enhance, a new and non-invasive device that uses electromagnetic fields for treatment and remote monitoring of patients with brain disorders. It consists of sensors and emitters that are connected in a feedback loop for real-time modification of the treatment protocol using machine learning algorithms. So how does Enhance work? Well, if we imagine our neuron being like the road on which a car is traveling, when someone has a neurological disorder, this road is filled with road bumps. This means that this car or the signal cannot go as fast nor as far as it would like to. When Enhance comes in, it knocks these roadblocks out of the way, allowing for the car to propagate at normal speed and normal distances. But let's get down to business now. The size of our market is 538 billion euros, while the serviceable obtainable market is 1.6. The main players on our market are Medtronic, Abbott Laboratories, Johnson & Johnson, and Siemens. Our direct competition are 2 main players, which are Optune and BrainQ, which both use electromagnetic fields for treatment of certain brain disorders, but they deliver a static treatment protocol and are therefore insufficient. I started developing this idea in 2017, and in 2019, we obtained 70,000 euro proof of concept funding by Hamad Bikr and Croatian Ministry of Economy, with which we were able to build an early prototype and test it on cell cultures, as well as submit the patent application, which was published in September of 2022. Now we're currently raising a pre-seed round of 400,000 euros, with which we will be able to develop the sensors and develop a prototype that's ready for animal testing. But who is this we, though? That would be me, Dinko, and Philip. I'm an expert in electromagnetism and biophysics of the nervous system. That was literally what my PhD was on, and I'm the project leader. Then we have Dinko. He's our preclinical research manager with over 20 years of experience, and he specializes in neurodegenerative disorders. I met Dinko in 2016, and in 2020, I defended my PhD thesis in his lab. So he was also my mentor throughout all of this. And finally, we have Philip. He joined our team in 2019. He was the chief developmental engineer for the Enhanced device because we already built a prototype, and he's a regulatory compliance officer. So with that, I would like to leave you off and thank Philip and the Urban Center for this opportunity. And I'm looking forward to seeing what else we do here. Thank you.
Thank you very much, Yasmina. So I think Philip is disconnected. So thank you again, a very interesting technology. So now I'll leave the floor to Peter to present his startups, Nuove Health, correct?
Yes, that's correct. Hello, welcome. Thank you for having me here with you and having the opportunity to present our startup. So my name is Peter Bilosnich, and I'm coming from the company called Nuove Health. And yeah, let's see what we are doing. Okay, so as you can see, this is Germany, and Germany has a population of 82 million inhabitants, and it's actually the market of our interest. So why is that so? There are a few facts. First of all, in Germany, every 6th German consumes some kind of supplement daily, and 80% of these people don't have a diagnosis. So they don't know why they take this supplement, and they even don't know what is the outcome of this therapy. To understand the market better, you must know that only the vitamins and mineral supplements market in Germany is 2.7 billion euros. So it's a huge market. But there's also a dark side of this problem, or what we're here addressing. And for example, in Germany, we have 9 million undiagnosed people with chronic kidney disease, which is symptom-free until kidneys are seriously damaged. And 70% of all global deaths are related to such non-communicable diseases. That's why the World Health Organization highlighted that 2 of the 4 key components in response to non-communicable diseases are detection and screening. And that's where we at NUM ask ourselves, okay, if we know that detection and screening is so important, what is the reason? What is the why behind why people do not regularly test themselves, check their health, and try to stay healthy? So in regard to this, we have conducted over hundreds of interviews with patients, customers, people who were taking laboratory tests. And we came to two conclusions, very simple conclusions, but difficult to tackle, to address, I would say. So the first one is that people don't have time and energy to get diagnosed. So unless they have severe symptoms, they have no time. The other one is money. So they cannot afford, let's call it, regular health checks, frequent health checks. And based on these two problems, we have derived our vision or our mission. So as with every health startup, of course, we want you to stay healthy, but we want everybody to test frequently, regularly, before and along your any therapy. So any therapy that can give you insights about, okay, your healthy status. So in regard to this, we came up with our product, our solution. It's a convenient self-test with a medical result. And in order to address the problems which I mentioned, we need to focus on one strategic aspect, and it's low-cost leadership. So our main focus will be low-cost leadership in all areas of business. And in order to get to this point, we need to be innovative in diagnostics, operations, and digitalization. But how does our product look like in the process, in the real world? So via our web shop, you can order such sample collection kit, which you can see here, which is already ready, which will deliver it to your home address. At home, you take a blood sample through such a dry blood card with a few drops of blood out of your finger, so capillary blood, and you need to activate this card via our web shop in order that we can later deliver the digital results to your mobile phone or desktop. But before that, you need to ship it to the laboratory. Shipping is already paid, and at the laboratory, we analyze your sample and we deliver you the result once the result is ready. This takes about 5 to 7 days. And in order to make it function, we need an infrastructure. And this is our current infrastructure. So we have a registered medical lab. We have a sample collection kit in 2 different packages, types of packages. And we have a web shop and web application which helps us to sell, to activate, to track progress, and to deliver our digital results. In our offerings, we have several over 10 validated biomarkers from vitamins, minerals, hormones, etc. And we have several in our pipeline which are planned for later. And that's actually also something that we consider as a competitive advantage, as you will later see the people which we have in our team, that we are actively involved in developing new methods with partners from the private sector and B2B partners in order to deliver new solutions. But who are we? We are a team of 4 experienced founders. We have all plenty of experience in other startups, which more or less were successful or even failed, but that's all our learning, which we introduce into this startup. And beginning from the left, we have Ozan Miller. He has over 20 years of experience in the pharma industry, and he led big pharma brands which had a sales of 300 million euro. Myself, I have almost 20 years experience in the area of digital product development and management, software development, digital strategies, and similar. Then we have our science part with Dr. Tomasz Bienkowski. He is responsible for diagnostics, over 20 years in these fields. He is the owner of the medical laboratory and responsible for diagnostics operations. And Dr. Konrad Konwalski, he has experience with over 10 years in developing diagnostic methods. So how does our roadmap look like, or how we would like to develop? A few weeks ago, we started with our alpha stage, with our MVP. So we have an MVP product. We would like to focus, or we will focus on operationalization, stability, and efficiency in all processes. So to get a reliable and robust system, a business system, diagnostic system, we will launch additional biomarkers. Our first product is the vitamin D test. It's a wellness well-being test, but it's a very effective marketing tool. And we would like to test our market assumptions, our consumer assumptions within the next few months in order to reach the target of 5K users. For this, we are looking for an investment of 150K euro, and that's also our financial ask in this pre-seed phase. From the beginning, or from 2024, we would like then to continue our business and focus on early innovators. So it's 2.5% of our market, the German market, which we are tackling. We are looking into signing our first B2B partnerships, automatization of our processes, improvements in product and marketing, and our target goal is 50K customers or sold tests, and investment approximately of 500K euros. 2024 is also some sort of turning year for us, because we would like then to invest in our own facilities in Germany, so to have our laboratory facilities even closer to the consumers, all about leveraging our strategic goal with the low-cost leadership. And for this, we are planning to reach 150K users, or with such an investment. And for this investment, I guess almost 2 million euros are needed. 2026, we will see. Hopefully, if we are still in the business, that means we are doing good, and then we can look into a bright future. That's all from me. Thank you very much for this opportunity, and feel free to contact me and reach out with questions. Thank you.
Thank you very much. Really, it was a great opportunity for us to learn the Croatian ecosystem and two very interesting startups. So I think this is really an example of network creating, and I think we will keep in touch really soon, both with Vlatka, but also with Petra and Jasmina, because I think there is some interesting point of connection between both urban center here in Trieste, so at the area of science we have, but I think also with Mind in Milan, with the headquarters of Bio for Dreams, because we really believe that only think globally. So and sharing the international opportunity, we can help people in the health sector. So I hope if you have any question, because I will have a lot of questions with all of you free, but I think it's better in separated call, or if you want to visit us here in Trieste, it will be a pleasure to host you. But I think we will keep in touch very soon, and also to sharing directly and in a confidential way, also the opportunity here with the ecosystem of urban center in order to promote both parts. So thank you again.
Thank you. Yeah, thank you very much. Thank you for the invitation. Thank you for for making this connection and allowing us from the university, of course, and the Lean Startup Croatia and the teams to present. Looking at the presentations that you made about your activities, I would definitely agree with what you were saying. That there are points of the connection that we can explore, and would be very much looking forward to this for us to then connect again and meet and see how we can work together in the future.
Absolutely. So thanks again. Welcome to Urban Center and to the ecosystem of Bio for Dreams, and talk to you soon. Thank you very much.
Thank you.
Thank you.
Bye-bye.
Bye.
Thank you. See you. Bye.